I'm a product safety lawyer practicing over 15 years in the field of defective, dangerous products and negligent safety standards. We're in a constant battle against the dangers of the world, and after focusing my practice on helping catastrophic or fatally injured victims, I want to do my part to help defend people from becoming victims in the first place. Like pretty much most of you watching this video, the first time I really started caring about car seats is when I found out I was going to be a parent. And I started researching every baby product that was out there. And what I found was a lot of information about the newest trends and the latest and greatest. But what I really wanted was something that did a deep dive into a product's safety and the risks that come with it. And so that's where I began my research. What I found out were that car seats in the US versus Asia versus Europe versus even Canada had distinctly different safety features. And what would happen was that manufacturers would sell one type of car seat in one market and a completely different one in another. Which begs the question, why not just build and sell the safest car seat possible? To understand why, we have to begin with the fact that these products are subject to different and varying governmental standards. For roadway-related product testing, we often come across NHTSA, NCHRP, FHWA, FMVSS, and these agencies provide the bare minimum tests that a company must pass in order to meet and receive governmental approval. The problem is that the government's bare minimum test criteria never is nor will be the best and most innovative out there. And it's not a knock on the government. They're not trying to be the most innovative. They're just trying to set the bare minimum standards that are out there. And it's up to private industry to innovate and design and manufacture and produce products that meet and ideally exceed those bare minimum standards. For example, FMVSS 213 was established in 1971, and it's gone years at a time without receiving a single update. So let's briefly chat about some of these standards. We've already covered several of those in the US. In other parts of the world, there's R129 in Ukraine, Tunisia, New Zealand, and various other places. Some parts of Europe also abide by R219, while others comply with another criteria, R44. So let's show some of these differences. So among the various differences, R129 requires the use of a tether or load leg as an anti-rotation device. It also requires a frontal crash, rear impact crash, and side crash testing. And finally, R129 also requires that all testing be verified by a third-party approved authority and technical lab. Now, the United States NHTSA testing, the FMVSS testing, does not require load leg, and in fact the test must not be conducted with one. And while it does include frontal impact, there's no rear impact crash testing and no side impact crash testing, although consumer groups repeatedly request that side impact be incorporated. Finally, there's no third-party verification process, as the manufacturers conduct the test, review the test, self-certify the test, and submit the tests. Now let's talk about the differences in car seats that have load legs or even what's known as an anti-rebound bar. So the purpose of a load leg is to reduce the momentum that's gained by a car seat that lacks a load leg. In other words, if it doesn't have something preventing it from moving forward, particularly in a frontal impact, the car seat will then bend forward and then go all the way back. There are studies that show that a load leg can reduce the forward movement during a forward impact by up to 90%. And that can decrease a baby's head injury value, also known as HIC, head injury criteria in the industry, by up to 33%. The best example I can give is think about being tightly strapped in a roller coaster. The more strapped you are, the less your body's flailing around. Whereas if those straps are not as tight, your body has more ability to move around, allowing you to be injured, not just from the forward kinematics of the movement, but also the impact within the structure that you're seated in. Now, an anti-rebound bar comes into play after that forward moment has occurred. So in other words, the car seat has now gone forward and it's rebounding backwards. So now you have a second opportunity for all those injury issues that we just discussed. The anti-rebound bar acts as a way to mitigate that. Again, think of it as this roller coaster example, except the car seat itself is now strapped in tightly from front and back. The load leg prevents it from moving forward, and the anti-rebound prevents any forward movement that did occur from going back. And all of that protects the child from flailing back and forth inside the seat. And again, studies show that the anti-rebound bar can reduce that risk of injury by up to 66%. So then the question is, which one should I get? And the challenge there is, because here in the US, the bare minimum testing criteria does not require a load leg or an anti-rebound bar, many of the car seats manufactured here don't include either one of those and have not even been tested to include either one of those, subjected to the American test requirements we discussed a few moments earlier. Most most, if not all of my cases involve expert witnesses. And one of those types of experts is known as a biomechanical expert. And their job is to describe the kinematics of the body, particularly in motion, and how it will react based on different forces as they're exerted upon them. So in addition to reviewing the studies that are out there, doing my own research as to the different types of car seats that exist, I also had consulted with several of those experts as well in order to gain an understanding, or better understanding, as to all of the pros and cons with different types of car seats. Again, there's no absolute certainty as to what's the safest product out there. And in all fairness to all those companies, each safety measure comes with its own potential risk. In the industry, we call it FMEA, failure mode effects analysis. In other words, you look at what could go wrong. For example, with the load leg, you have another structure that goes down to the floor of the car seat. Potentially, that means objects that could be rolling around there could hit it, and now you have something that can act as a lever to alter the movement of the car seat. Now for me, I wanted a car seat that had both the anti-rebound bar and the load leg. So the car seat would be protected, or ultimately the child inside the car seat would be protected in the case of an impact from the front or the rear. So now let's talk about some other risks associated with car seat usage. One well-studied and documented risk is the need to minimize the amount of time that a child is asleep in a car seat. And the younger the child, typically the greater the risk. And the reason for that is because the angle that a child, particularly a young child, sits in a car seat is not one that mimics the one that's in a crib. And what can happen in some instances is that the positioning of the child can cause something that's called mechanical asphyxiation, which means that the child head leans forward and that can cut off the airway as well. And that brings up another consideration when buying a car seat. I know for us, we wanted one where we could attach quickly to a stroller in the event we're running errands and we just want to take the baby in and out and be on our way. What's important to remember is that if you get a stroller that is of the same make and model of the car seat, typically they're designed so that the anchor attachment points are optimized for the car seat's angle. Whereas if you get one stroller from one manufacturer and a car seat from another and you have to use an adapter, then there's no guarantee that that angle of that car seat, however slight it may be, is going to be optimized. And optimization is important for safety because, again, if it's a little bit too far forward, that could be enough for the head to go a little bit too far forward than we'd like. Now, with all of that said, of course, these are all risks that can be mitigated by any parent. This is not meant to make anyone feel bad or wrong for choosing any type of car seat. I'm just passing on the information that I learned. Again, there's only so much we can do to protect our children from the world that's out there. All I'm trying to do as an attorney who's dealt in the realm of product safety for the past 15 years is look for ways to mitigate those risks. I hope this has been helpful as you continue your never-ending research project for what's safest for your child. And never forget, safety is fun.